Hey there, my name's Dr. Susan Plank, and welcome to today. We're talking about a lot of folks have a suspicion that their thyroid is, not functioning right. They think, hey, my metabolism's sluggish, maybe my hair's thinning and falling out, my nails are brittle, constipated, cold hands and feet, all the classic symptoms of hypothyroidism, low thyroid, and yet their doc keeps telling them, no, we're not going to test it, or we tested it and it's normal. And yet the person's still left feeling like, I really think it's my thyroid. So what is going on? So I wanted to talk to you about this today. This is from a seminar, a bigger webinar that I did, Mysteries of the Thyroid. And so what I want you to realize is, first of all, TSH, which is what's being checked, is what's being tested for. It's not a thyroid hormone, okay? It is actually released from the brain, from the pituitary hypothalamus. TSH is released and it goes and actually communicates to the thyroid gland, this butterfly-shaped gland. It's right in the front of your neck. It communicates with the thyroid saying, hey, you need to speed up production. We need more hormone out here, or hey, you need to slow down, right? One or the other. And so this is constantly going on, and it's communicating with the thyroid gland whether it needs to produce more T4 and T3. Those are actually thyroid hormones. But I want you to understand that TSH is not a thyroid hormone. So we have a lot of moving parts here between the brain and the thyroid gland, and then every place else where those thyroid hormones are going to communicate with. And that's what I wanted to talk to you about. So if you're suspecting that you're hypothyroid, you might very well have a sort of a clinical sub-hypothyroidism going on. And let me tell you why I think that is. So you're going to see here again, brain, right? Pituitary hypothalamus, release the TSH. That goes down and it communicates with the thyroid gland. Now, the thyroid, to actually make hormone, needs tyrosine and iodine. So I want you to start to understand, if the thyroid doesn't have at its disposal the building blocks, okay, if it doesn't have enough tyrosine, if it doesn't have enough iodine, so like T4, just to give a brief explanation, T4 is actually 4 iodine molecules. Who knows why they didn't name it I4, but they named it T4, right? So T4 has 4 iodine molecules. And then when it goes to communicate with the cell, the active form of the thyroid hormone is T3. One of those iodine molecules are cleaved off once it goes out to the cells. Every cell of the body has receptors wants to communicate with the thyroid because it affects all those things I just said, metabolism, your energy, right? All these cool things. So what happens is the TSH communicates, we'll say it ramps up. So, hey, we better have enough tyrosine and iodine, right? The recipe to make more actually T4 and T3, the true thyroid hormones. Then those, right, are needed to carry by thyroxine binding globulin. So that comes from, globulin is part of our immune system. Our immune system is all made up of globulins, but you also get from a breakdown of eating protein. Okay, so you need to have a binding globulin that carries actually T3 and T4 from the thyroid gland to the cells of the body. Okay, now you can still have T3 and T4 sort of floating around in the bloodstream, and they're not carried, they're not being sort of picked up and carried to a receptor on cells. Those are what is free T3 and free T4. And as they decrease in the bloodstream, they go back and communicate with the brain, and then the whole process starts all over again. Okay, the TSH is released. But I want you to understand that there's more moving parts here, okay, of what's needed other than just thyroid hormone. So if you think you're sluggish, right, and you very well might be, I want your TSH level actually to be between 1 and 3. If your TSH is right around that 2.5 mark, then your TSH is actually chugging along pretty good. It's really pretty good. But that doesn't mean that your body has necessarily enough tyrosine, iodine, selenium, some of the other cofactors needed to complete this whole process and make the hormone and actually carry it around the body to the thyroid receptors. So I wanted to do this little video just to sort of key you in. Please don't give up hope if you're having the symptoms and yet the blood work seems to be normal. That's okay. There can still be something going on that's actually not, right, that is doable with nutrition, meaning you don't have to take a medication the rest of your life, but we just need to find out what that is for you. Okay, so I hope you found this helpful. Please check back soon for another video, and thanks so much, Dr. Susan Plank. Check it out. Have a great day. Bye now.